All right, thank you very much, all. And all right, we're up and running there. So this will be a physician's perspective, a little bit of what you heard, but a little different twist on it. Here is maternal instinct versus scientific debate. We've been listening about for all the science reasons, the arguments from the EPA are false, but this is what the public sees and does, and this is very difficult. So if it sounds bad, that it's all that these moms need to hear, and it is hard to overcome with cold facts alone. Such do-something demonstrations find politicians and agencies all too ready to craft new legislation and regulations. I view this much like physicians who succumb to patients' do-something demands by prescribing antibiotics for the common cold, a useless, if not dangerous practice. So, and why does this sort of appeal work? You can read them down there, and my comments are that you note that they are in the street TV interviews showing fearful reactions to the chemical name dihydrogen oxide, which we all recognize as water, but it drives some people crazy to think that they are being exposed to it. If the air is hazy, it must be injurious to one's health. Assume that any and all substances in any amount may be injurious to health until proved otherwise. Economist Julian Simon coined the term false bad news to describe the innocuous made to sound harmful by the media when they target a cause to demonize. Even convincing scientific rebuttals are mostly ignored by the media since they specialize in publicizing bad news and their own prejudiced agendas. Hollywood celebrities and politicians have become authoritative fonts of scientific knowledge for the media-obsessed public. All right, so maybe back here a little bit of medicine. Clean Air Act pollutants, they are 6 specific ones, are down. So why has reported asthma incidence gone up? Some possible factors are increased awareness, expanding its definition to include all reactive airway disease, and blunted development of natural immunity as the childhood environment is made perhaps too clean to challenge developing immune systems. Never let a hypothetical disease go to waste. Does that sound paraphrasing something? Look for those data that prove the assumption. PM 2.5 is the most peculiar disease-causing agent when compared to traditional disease concepts such as Koch's postulates, which deals with infectious disease. Its pathophysiological mechanism is undefined. And we can see it's hard to make a case for something that has no known mechanism and varies from place to place and is only sorted out by size. PM 2.5 represents a mixed bag of substances solely united by being really, really tiny. They must pose a substantial health threat because the EPA thinks it so, it believes so. That is a quotation there, believes. EPA believes it, must be true. PM 2.5 death from short-term, long-term, and any dose are really scary stuff. What level is a healthy level or safe level, and by whose and what criteria? The last statement there, if we could reduce particulate matter to healthy levels, it would have the same impact as finding a cure for cancer in our country. That's the Jackson testimony before Congress. I have put reference links on each slide. It's proved I didn't make this up. Okay, so the EPA says PM 2.5 is a disease. I call it a postulated disease of statistical etiology. But the EPA does need to test humans, I guess, just to be sure. So volunteer applicants are given something of an informed consent. All right? They are told that everyone is exposed to PM in daily life, and it has been associated with increased illness and death. But on the other hand, EPA has conducted 297 controlled human exposures to PM 2.5, with only one clinically significant event in which the study participant experienced no harm or injury. So is it bad or isn't it? They're still trying to figure it out. PM 2.5 particles are not standardized, as I said, and they vary according to location and composition. All that matters for their designation as toxic is their size and outdoor concentration. All right, mice and men here. There are many studies that are quoted, but you would have to know what animal strains, what human test objects, what test dose size, what other confounding factors. Are they valid, random population samples, or biased selections? Computers can be programmed to find the sought-for correlations. Weak statistical correlations are presented as claims of proof of cause and effect, and that is not true. Data banks are trolled looking for that needle in the haystack clinical correlation, which then can be used to project concern to the general public. Find one person who succumbs to it, therefore everybody is likely to succumb, is the theory. Once again here, another disconnect. Human test volunteers are given a sort of informed consent. So on the one hand, 6,000 volunteers over 30 years, not a single serious event. On the other hand, here we have 10 million particles exposure, no clinical relevant changes. They're still looking for a disease. All right, here is the famous Harvard Six Cities studies. That has a lot of problems, but in any event, we're talking about relative risk here, and this is the way of evaluating the hazard to health of a factor. The legal standard has been a relative risk of 2 or above, and you can see the numbers here. I didn't put a line there, but they're clustering slightly above 1, even below 1. We are certainly nowhere near 2. And these Harvard studies have walled off the raw clinical data from independent investigators, as others have mentioned. Here, this is the Secret Science Reform Act referred to by others, and this has been prompted by the inability, as we've seen, of independent investigators to access original data. This is a real crime. All right, observational correlation. All right, 0 to 1, I want to point out to you here, short lags, 0 to 1 days of exposure to 13 micrograms per cubic meter of this EPA 2.5. So 0 to 1 is almost instantaneous. Here is another study showing the amount of cigarette smoke per 100 cubic meters. And numerically, we're going from the Harvard data, where we're dealing like 10, 12, 15, all the way up 600 and above. All right, my favorite slide here. You've seen these smoking walled-off glass booths at the airports. The hazy slide over there is Shanghai. All right, the airport is 10,000 micrograms. When we're worrying, the EPA is worrying about 15, 12, or 10. Somebody should have dropped dead in there, surely. Shanghai, life expectancy, 82 plus years, the PM 2.5 level exceeds 600 micrograms chronically. They've got longer life expectancy than we do. So, all right, on to carbon pollution before I run out of time here. The EPA seems to have forgotten that humans are carbon-based life forms enmeshed in the carbon and Krebs cycles of life. And this should all be stuff that's familiar to you. All right, the EPA construct. Carbon plus pollution result new disease vector, known as carbon pollution. Here is an orchestrated propaganda effort linking an essential component of life in the Earth's atmosphere with an emotionally laden negative connotation word, a sort of Saul Alinsky wordsmithing effort to create a new, fearful-sounding label with which to demonize fossil fuels. It's a psychological media campaign working to shape public opinion to fear the normal by evoking guilt by association. Here's the EPA's Clean Power Plan. And while you're looking at that, those are their desired ends. What about the negative public health impacts from more expensive, less available, less reliable electric energy? Affordable by whom? What about the loss of jobs and incomes to support good health and nutrition? Wind and solar are oxymorons for reliable energy. We see here a clean equal good, pollution equal bad, soundbite battle for the mind. and I'm going to shock you here with the facts of life. The carbon dioxide facts of life, at least. Our lungs operate in 40,000 parts per million, in other words, 4% in each exhaled breath. We're worried the atmosphere is 400 parts per million. Carbon dioxide is a plant food, and the plants in turn provide us with oxygen. Pretty basic. We'll read through all these, you can look at them later, but the EPA claims unchanged carbon pollution levels will do all these nasty things. It becomes an unbounded scapegoat for any real or imagined societal or health ill. Anything is possible. Here's a recent paper. Cold weather kills 20 times as many people as hot weather. Folks do go down to the warmer climes when it gets cold up north. They have the Canadian snowbirds and others, so certainly for a certain population, they want to avoid the cold weather. Another way of looking at the data, atmospheric CO2 has not lived up to its panic-inducing billing. This failure has spawned a variety of new labeling terminologies, such as climate change, climate disruption, climate weirding, and the only real disruption has been to expose the falsity of the CO2 scare story. 10% increase in CO2 over a time period where there is basically a flat line change of global temperature as measured by satellite measurements. This doesn't sound too bad. This almost sounds hopeful. No less stringent than necessary. It doesn't have to be zero. That's coming from the EPA. That sounds almost reasonable. Don't worry. Excuse me. Ambient air will never be clean. EPA said standards are ratcheted ever lower because there is no threshold level of fine particle pollution by which health risk reductions are not achieved by reduced exposure. The perpetual employment machine for the EPA. All right, the ozone standard, 75 parts per billion. They want to ratchet it down to 60 or 70. Talking about public health, protected from what? Not adequate. How measured? Is this a product of computer modeling? Yes. What evidence is presented as validated evidence? There isn't, and two prior speakers have covered that. Also, we have to worry about what's called the public welfare. We have to worry about the plants and trees and whatnot. And the same reasoning or lack of it applies to that. There's lots of room to speculate. Ozone levels have been and they continue to decrease in the US with measures already set into place. I did dig through part of 575 pages of that report up there, 214. And here is a summary of basically the results of going through all these hoops. Lives saved. And if I read it correctly, this is out of 350 million population, more or less. As you would ratchet down the amount of ozone parts per billion, 70, 65 to 60, and the ozone ratcheted down in the red below there. The red numbers are the lives saved. Now, of course, every life is worth it, but we're talking about out of over 300. These numbers are so small as to be statistical noise inseparable from daily random events. What is a premature death anyway? How does a physician diagnose a premature death? Real doctors do not see premature deaths. Only computers sifting dodgy data and using wobbly confidence brackets experience premature statistical deaths. And this is the best they could do doing that. All right, we talked about money flowing from the EPA to scientists and their results flowing favorably back to the EPA. How much EPA funding for alternate hypotheses? So far, I think we're pretty much aware it's zero. Are such studies free of EPA influence and vice versa? The public reads these headlines as the media ignore contradictory scientific studies. Borrowing from the fashion world, I term this bespoke science, or made-to-order science, made-to-measure science, tailored science, and the dollars flowed to make it happen. In 1961, President Eisenhower warned The prospect, and I'm quoting, the prospect of domination of the nation's scholars by federal employment, project allocations, and the power of money is ever present and is gravely to be regarded, end of quote. To which I say, how sadly true 50 plus years later. A little bit about asthma. As I say, when scientific data fail, invoke emotional arguments, such as my first slide. So you can see Lisa Jackson doing that and President Obama. Question is, there has been no change in global temperatures for 18 years, and of course, his daughter could not have, therefore, been exposed to any climate change. Clinical asthma. Well, this gives a clinical rundown. I don't have time to go through each one, but it's basically an inherited disease. Largely, it runs in families. It's a disease of perhaps a little akin to climate change. We don't know everything about it, but it's primarily set off by certain antigens. Most of those are protein or plant-related allergens. So there's a variety of things going on with that. But Steve Malloy's and the two prior talks both point out that hospital asthma admissions were not increased as the ozone or PM 2.5 levels were dissected and examined. Some triggers, but it's usually not triggered by exhaust from a power plant. It's usually from pollen from plants, and that is quite a different thing, and the EPA is not trying to regulate that. Next to last slide here. This was in a paper, the Journal of Asthma and Allergy, October 2011. And I've quoted here. Trends in the incidence of childhood asthma worldwide have paralleled the sharp increase in CO2 emissions. Prevalence, blah, 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 has quadrupled over the last 20 years, in part due to climate-related factors. To which I say, is this the current standard of scientific proof for publishing in scientific papers? Partly due to, maybe, the sky's the limit. Nothing is proved. Last slide. There was some mention of Yale versus Harvard. Here's Yale's contribution. This was from a department in the references on the bottom. Anesthesiologist from Yale who had detected traces of anesthetic gases in Antarctica, I believe. So when I was in full-time practice, these were the things I worried about. Now we have to worry, as Yale says, the impact of anesthetic agents on climate change. My anesthesia patients responded most cleanly when I introduced myself as the doctor who was there to make sure that they would wake up, not as the would-be guardian of the climate. So in conclusion, how might we counter this deluge of false bad news? As a physician, my guiding principle must be, first, do no harm. Money and politics serve their own ends by preying upon the public's health fears. This is a process abetted by a non-inquiring or biased media and activist groups. Those within the political process should recognize the pitfalls of catering to just do something provocations by enacting legislation based on fear and ideology rather than on sound science. Quite simply, the very real ills of unintended consequences follow from the wrong diagnosis of the wrong disease and the wrong therapy. Thank you so much.